Namaskaram all. Myself Dr. Ramya, Professor and Head Department of Panchakarma, Ashtamgam Ayurveda Vidyapeetham. Today I am here to discuss with you one of the very important issues that many among us experience, sleeplessness or anidra in Ayurveda. Ayurveda considers sleep or nidra as one among the three pillars of life. To maintain life, a human being needs to be having three aspects in life, that is ahara, the food factor, brahmacharya, and the so-called nidra, sleep. So, sleep is one factor which is responsible for maintaining the longevity of the individual. There are many factors like ayu, that is the longevity, balam, the strength of the individual, sukham, dukkham, sorrow and happiness, pushti, nourishment. All these factors depends upon the proper sleep that one individual experiences. Charaka Samhita has studied sleep in a very detailed way. Ayurveda compendium speaks about various aspects of nidra and what happens when one is deprived of nidra and what are all the issues that one faces when one is deprived of sleep and how can we manage it. Ayurveda defines or divides sleep in different formats. There are 6 types of sleep that is mentioned in Shastra. The first one being tamodbhava, that means sleep because of inertia. Shleshmodbhava, sleep caused because of the aggravation of kapha dosha, one among the 3 humors of Ayurveda. Sleep because of the deprivation of stress in body and psyche, that is sharira mana shrama samudbhava. And sleep because of the causation of other diseases in the body, something called as vyadhi anuvardhani nidra. And sleep deprivation because of akanduja factors, that is external factors like environmental factors, when there is an earthquake, too much of water, too much of rain, etc. So some external factors can deprive sleep, and of course the most important which is natural to us is the ratri samudbhava sleep, that is the sleep that one has to have normally when the night arrives. So what's actually happening in sleep is, our daily perception, what we call as indriyartha sannikarsham in Ayurveda, wherein the sensory object is getting in touch with the sensory body that we have in the form of jnanendriya, which gets in contact with the manas and the awareness happens. So when the manas is detached from the indriya, naturally this perception is not happening. So we all are aware that when there is a sound or when there is lot of light over there or some other disturbances, it's very difficult to get a sound sleep. So when the manas and indriyartha sannikarsha is being detached, so naturally manas gets into the atma, which actually leads to a very restful state for the body, which is very important for us to sustain a long life in the most productive way. So this is actually the mechanics of sleep as we understand. Now when we see what actually could be the causes that can deprive sleep, there are n number of causes that can deprive sleep, which can be divided broadly maybe into the physiological causes and the pathological causes. Physiological causes, you mean there is no specific pathology, but if somebody is not having enough water, or somebody is not having enough food, hunger, or somebody is stressed to an extent because of some XYZ reasons, all these things will be affecting our normal physiology, which again can result in the so-called deprivation of sleep, which we have to understand. So maybe we had a night-long awakening for a few days because of some kind of engagements, which again can lead to a disturbed sleep later. So if this is just physiological causes or due to the activities that has affected our physiological process, then if we correct that activity, maybe we will be able to regain it. Now when coming to pathological issues, there are n number of pathological problems, starting from the basic problems that one faces, the pain that can be at any system that is affecting you, whether your locomotor system that is being affected, the issues with your abdomen, the issues with your skin, all the areas when there is pain in the body, it definitely deprives the sleep. And there are many other psychological issues which when it affects you in a very deeper way can deprive you in the so-called having a sound sleep. And of course, there are some specific psychiatric pathologies which can lead to sleeplessness. Other than that, any kind of disease, a particular stage, if it is disturbing the normal existence, whether it is the onco-related, cancer-related cases or any neurodegenerative diseases like Parkinson's disease, motor neuron disease or Alzheimer's disease, all these issues can have sleeplessness as a part of it. So in that case, what is more important is we need to identify what exactly is the cause of the sleeplessness or anidra, and it has to be corrected for one to get the proper sleep. So first, when we discuss how to manage this sleeplessness, the first thing that we practically do is to identify the cause that is actually resulting in sleeplessness, which is actually the most important part of it. Now, what other things, if it is a physiological cause or generally if somebody is not having a sound sleep, what are all the other things that we practice on a daily basis is something like, there are few techniques. One among them is Abhyangam, or just application of oil all over the body and having a good bath, not only in the body, and something called as Shiro Abhyangam, wherein some specific oils are applied in the head before taking bath and they can undergo bath, which again can induce sleep. So there are n number of oils. Of course, it has to be selected according to the constitution of the individual, the prakriti of the individual and his nature, which every thailam or specific thailam has got an affinity. So there are n number of thailam like Bala Guluchadi Keram, Bala Hatati Thailam, Trufaladi Keram, Trufaladi Thailam, Brungamalakadi Thailam, Kayonyadi Thailam. There are many number of head oils that are used generally, Nishoshiradi Thailam, etc., that are used generally to induce sleep in a normal way. By correcting the so-called guna changes in the body as far as Ayurveda is concerned. Other than Shiro Abhyangam and whole body Abhyangam, ultimately what this is doing to the body in our understanding is controlling the vata, which is actually responsible for the sleeplessness. And from that, the normal other practices that we can do is something called as Nabhi Puranam, which indicates, there some specific oil kind of things can be applied around the umbilicus in a particular format once when you are sleeping, and that can actually help to reduce the pitta in the body, and to an extent it will again support induction of good sleep to the individual. So these are all the daily practices that we can do to improve the sleep of an individual. Now other than these, if somebody is having or deprived of sleep because of reasons that I mentioned earlier, pathological reasons, it has to be identified. And there are n number of Kriya Krama or procedures which we will be doing specific to the clinical condition and specific to the individual, analyzing his status at various levels. So procedures like Shiro Taila Dhara, wherein oil is applied or poured in a specific format over the head. Kshira Shirodhara, wherein specific milk processed with specific drugs are used for the Shirodhara. Takradhara, wherein buttermilk is processed in a particular format to do the similar dhara. Talapodijal, wherein some medicines are mixed in a particular format and applied over the head. Vasti, which is therapeutic enema, wherein, as I mentioned, it is Vata and Pitta that is actually responsible for Anidra as far as we understand it. To correct it, if the pathology or the issue that's causing Anidra is a systemic issue, definitely we usually correct it with the Panchakarma procedures like Vasti and Virechana. Virechana is therapeutic purgation and Vasti is therapeutic enema. The individual is assessed for that and the procedure is applied. And finally, one of the important procedure that helps to induce sleep is Nasyam. After Koshta Shodhana or correcting our gastrointestinal motility or activity or digestive metabolism, then we take care of the higher mental functions through process called as Nasyam, wherein specific mentions medicine is applied through the nose in a particular dosage after again assessing the individual, which helps again in supporting or induction of a good sleep. So definitely people who are suffering from sleeplessness because of XYZ reason, Ayurveda can help to a great extent. It's very important that when we live in this world, we have a sound sleep, so that which ultimately will give us a peaceful and joyful existence. Namaskaram.